When I first began in dentistry, it became clearly apparent that total overall health of the mouth influences the body. And so I have really committed this office to understanding all the latest science that interrelates between the mouth and the body. So I'm not just interested in the mouth, I'm interested in keeping people healthy totally. As you see over here, I've created a dental medicine resource center. We're really looking for overall health.
The experience has been just absolutely wonderful. Dr. Buzz has been terrific. He's compassionate. He's caring. I have never had a dental experience like this before.
It's been wonderful. It has been absolutely wonderful. Everybody has just been fabulous with me, working with my schedule, working with my time frame versus their time frame. Just fantastic people.
The uniqueness of our practice, I think, really stems from our commitment to our patients. Our commitment is a total commitment to their health. But I'd like to have another button back here to be able to... We're going to do significantly more testing for our patients, all the way from saliva testing to bacterial testing to using the latest radiographic techniques, which includes a CT imaging of the patient, which shows the patient in 3 dimensions, not just 2. 3D imaging is beneficial because it tells me a lot more than just teeth. I'm able to see your sinuses, I'm able to see your airway. There's many individuals we're finding today that have restricted airway, which leads to sleep apnea. I can tell you right now, sleep apnea is a big issue. So we are able to see the airway. We are able to analyze the condyles or the jaw joints. We're able to analyze sinuses, the teeth, of course. We're also able to see carotid artery calcifications. And so there's many patients we've referred back to their physicians. So we're going to use the very latest that science provides us to be able to advise our patients on the program of health. People that I'm dealing with have many problems, and the problems can be solved only with good knowledge. And the more knowledge I have and the more knowledge I can impart and give advice to my patients, the healthier they'll become. So one of the first questions I always ask my patients, what do you want to see happen in your life? What is your biggest problem? What brought you here today to be able to have us look and evaluate you?
I went to a dentist in '09. He did 4 implants, and I had to come back and see Dr. Buzz and have him replace all the implants. It was miserable. I had lousy teeth. I had nothing but dental problems for a very long time. It was lousy. I had pain, constant pain in my jaw, constant pain in my sinus cavities. And Dr. Buzz took care of that.
The mouth is the gateway to the rest of the body, and so if we use the latest science, we're going to keep people healthier. My goal is to have total health for my patients. Health incorporates not only freedom from disease, but the psychological health a person can have from a great smile.
Before my procedure, I had no teeth, and all I could wear was my uppers because the lowers never fit. The uppers were painful, the lowers weren't even there. I couldn't eat peanuts, I couldn't eat steaks. It was all soft food diet, and my self-esteem wasn't there. I couldn't smile, and when I did try to smile, I would put my hand in front of my mouth, to cover up, because I didn't want people seeing that I had these traditional dentures. And now I have a facelift dentures, and I have my smile and my confidence back. I smile all the time. People ask me, where'd you get your teeth done? Oh, you must take great care of them because they're beautiful. And I just sit and smile and say, yes, ma'am, they are.
If I could recommend a friend, the first one I'd tell him is get down here and see Dr. Buzz immediately. He'll sit with you for as long as it takes and help you with your problems. Most people are afraid of dental work. It's easy. It's a piece of cake.
It's a family event as far as I'm concerned. The dentistry that I do creates a totally different attitude with the patients. It's the most marvelous thing I've ever been involved with, because I'm seeing people's lives changing, and not just by giving them very simple dentistry. I'm changing their lives by allowing them to smile and be healthy again. And that is a great blessing for 2 people, for the patient, but also for me, because it keeps me on top of the game, so to speak. But basically, I have to find out what the patient wants to achieve in their life. And from that information, I need information to be able to understand the solutions. And so I sit down with my patients. We spend a lot of time, probably a lot more time than is typical, but I want to understand what the nature of the problems are and what the patient wants to have occur in their life. And that takes energy and time, but the end result is always an individual that has a much better life, both from the standpoint of general health as well as their dental health.
It's money well spent to invest in yourself and your smile and your focus in life to make things better in life. I was never able to find a job because of my smile. During an interview, I kind of, covered all the time, and I think that's what hindered me from getting a decent position. So I got stuck in my current, but now I've got no job promotion since I've gotten my teeth done, and it was a big job promotion. And I really think that this had something to do with it, this investment that I did for myself.
Well, I feel good. I feel the dental work is being done. I'm getting the process of healing. The surgery I had bone grafting done, and I had a sinus, an implant in the cavity area that had to be taken out. So that was traumatic. But once I got over that and the healing started, it's a great process. I just came the other night, and another doctor looked at it, and I'm on my road to recovery. And I love it. I love it here.
I don't believe in shame. So I believe in corrections. What can I do to make their life better? And today is today, yesterday is past. We can do nothing about yesterday. We can only do today and tomorrow. So my goal is to make sure that today's problems are taken care of, and I ensure that tomorrow's future is much brighter for the patient. And so it becomes really a joyful experience when I'm finished with my treatment to see patients give me hugs, kisses, and shake my hand. It's a joyful experience.
Oh, I love him. He's like a grandpa, but at the same time, he's your friend. He's your confidant. You can tell him anything. He sees me without anything, so that's pretty trustworthy. And I would trust him with anything for my dental work.
The staff is awesome to deal with. I don't have any problem coming here. They'll work with you late at night, early in the morning. And Dr. Buzz, he's funny. I mean, he's a card.
My nickname, Buzz. When I meet a patient, I always introduce myself as Buzz. Well, Buzz came from, I'm told, President Roosevelt, and I always say not Teddy Roosevelt, but Franklin, had a son whose nickname was Buzz. And so if you look at all the Buzzes of the world today, Buzz Aldrin, Buzz Lightyear, they all come from really the nickname that Roosevelt, I believe, gave to his son, Buzz. So that's where I got my nickname. My dad said my real name, Raymond Allen, was after his twin brother, and my mother said that's too long a name for a little kid, a little baby. So she said Buzz was a popular nickname, so I got the name Buzz, and it's kept with me ever since.
Come here. He's caring, he's compassionate, he loves every patient. He gives it all, his all.
Come in and check it out. The staff, the services, everything is just fantastic. They work together with you. There was no pain, there was nothing to hurt me, and now I have my smile back. And I'm just so pleased and happy, and I can just tell everybody, come and see these guys. They're absolutely great.
Well, it gives me great joy to be able to be part of that whole process. It's what keeps me going, because the more problems I solve for people, the greater my joy becomes. And because each person's an individual, but I get to have the whole collective group. I get to see everybody and the end results of all these things. So if we do our job well, if I do my job well and the patient is willing to use the tools and the diagnosis and the ideas I have to create health for them, I just see nothing but great futures.